Hi, I'm Peppi. I had several symptoms leading up to meeting and seeing Dr. Glazier. I had had those minor symptoms for quite some time, and the discomfort in the belly and the urinary symptoms and stomach just not hurting, feeling not right, tired, and that sort of thing. I spoke with my family physician as well as with several of my friends that were retired emergency room nurses as well as nurses from the floors, and the same names kept coming up, and they were Dr. Glazier and Dr. Gowda.
Pippi is a very pleasant patient who came to us who was having a terrible issue with quality of life after she developed significant prolapse and pelvic pressure that really impacted her quality of life tremendously. She had had prior multiple operations in the past.
So we proceeded with a minimally invasive robotic surgery, and she had excellent resolution of her symptoms.
And now her quality of life is significantly improved and it is back to normal.
Came to the retreat for my pre-op, and they did a really thorough history and told me what to expect on the day of surgery. Dr. Gowda and Dr. Glazier both worked together to keep the time of anesthesia as short as possible for me. My husband said he was amazed because of all the surgeries that I've had. He said it was the first time that he saw a doctor come out of surgery and he was smiling because everything had gone so well, and he was so pleased with the results and that everything had gone as he had hoped, and that there was nothing unusual or bad that happened, and everything just went so well. And when I woke up, I was expecting a lot more discomfort. I'd had abdominal surgeries before, and I'd had the old style laparoscopy before, and I was used to that really bad bloating feeling and the sharp pains in the shoulder, and I didn't have any of that. While I was staying here at the retreat hospital, the nursing staff was outstanding. They were very caring and compassionate. They stayed right on top of things. They not only looked out for my care, but they actually looked out for my husband, who decided to stay with me. They made sure that he was as comfortable as I was. There was no lag between shift change. They stayed on top of my pain medications, and they stayed on top of me being in contact with the doctor and knowing what was going on with my next step as far as discharge and planning for going home. They were so kind and so caring, and were able to take care of me in a great fashion. I feel amazing. I don't have the frequency anymore. I don't have any of the discomfort that I'd had in my belly just not feeling right. I don't feel as tired and run down as I had. I encourage anybody in that kind of position to follow up and follow through to see if there's something that can be done, because there's no reason to feel that bad for that long.